Most students who come into CAPS receive clinical services in the form of individual counseling, group counseling, or workshops, but sometimes CAPS will collaborate with a student to receive their counseling in the community. This decision may happen in the initial consultation, ongoing counseling appointments, or through work with the CAPS case management staff. In the event that CAPS supports you with finding counseling in the community, you might be wondering, what do I do next? That's a great question, and you've come to the right place for answers. Here's what we will be covering in this video. You can click any of the section titles to skip to that part of the video, or continue watching to see all of it. As you watch, feel free to take your time. You can pause the video at any time to read the text on the screen. If you'd prefer a format other than video, you can view a list version of the same information by clicking here or following the link in the video description below. If you have any more questions, feel free to contact CAPS. Before we begin, determine whether or not you currently have health insurance. If you do, continue watching this video and we'll take you through the process. If you don't have health insurance, or if you're not sure, don't worry. We've made a video specifically for you that lists some of the great options that are available. Click here to navigate to that video now. Part 1. Contact your health insurance company. Contacting your health insurance company is a good first move because looking for a community provider can be complicated without first knowing a little bit about things like your copay and session limits, which we'll get to explaining shortly. If you're currently on your family's health insurance, you can ask them for help with any part of this process. If privacy from your family is a concern for you, you have options. Click the link in the video description below for a helpful guide. We're going to help you through the process, but if this becomes too complicated or overwhelming, feel free to contact CAPS for help. Before you're ready to contact your insurance company, you'll need your insurance card and your insurance company's customer service phone number, which is typically found on the back of the card. You may also need to know your social security number, and if you're on your family's plan, they may also ask for some of their basic information, like the primary holder's birth date or social security number. A pen and paper to jot down notes may also come in handy. Call the number when you're ready. Often, insurance companies have automated recording systems for customer phone calls, so you won't be speaking with an actual person until you move through their automated system. Keep your ears open for the keywords coverage or benefits for behavioral or mental health care, and navigate there. Some systems will simply ask you what you're calling about. Feel free to speak those keywords into the phone. You'll probably want to listen for or mention outpatient services, which includes counseling and medication. Inpatient services refer to more intensive services, such as hospitalization or residential stays. Once you've navigated to the right place, here are some of the things to ask about. Look in the video description below for definitions of all 4 of these phrases. That was a lot to cover, so here's an example prompt for how to ask about your health insurance over the phone. Feel free to pause and take a look. If you get stuck at any point, ask the customer service representative for help. They're used to hearing all kinds of questions, and insurance can feel very complicated, so no question is too small or too simple. Your insurance company may also be able to give you a list of providers, so try asking about that if you'd like. After you've contacted your health insurance company and found out some information, you're ready for Part 2. Part 2. Searching for a community provider that meets your unique needs. First, you'll want to pull up a community provider database. Once you've found a database, you'll want to narrow down the search using your criteria. Most databases will allow you to filter results by your health insurance, location, preferences, the provider's expertise, social identities like gender, age, race, religion, sexual orientation, and more. Be as picky as you want to be. Some of these filters may not apply to you, and that's okay. From the results on one or more of the databases, you'll want to make a list of 3 to 5 potential providers that you feel may be a good fit for you. Other qualities to take into consideration may include passions, highlighted areas of experience, treatment styles, or perceived personality. If you're interested in seeking both counseling and medication in one place, contact CAPS for more suggestions. Once you've found some providers who might be a good fit for you, you're ready for Part 3. Part 3. Contacting community providers. Now that you have a list of potential providers, it's time to contact them to check for availability. You'll need your health insurance card and your schedule for the next couple of weeks. Again, a pen and some paper might come in handy if you think you might like to take notes. Here's an example prompt to start the conversation. Feel free to pause and take a look. Providers may not be able to take your call, so you'll probably be asked to leave a message. The same prompt can be used for leaving a message, just make sure that you leave your contact information. Some providers are also available by email, and it never hurts to verify that they take your insurance. And that's it. Great job! After you've called all your top choices, you should be on your way to meeting with a community provider. If you come across any challenges throughout this process, CAPS is here to help. Thanks for watching. Click here for our other video for those who don't currently have insurance or who don't know.